Gaudium IVF and Women Health is eyeing its D-Street debut. The company's IPO opens this Friday and the issue size is 165 crore rupees, of which fresh issue is 90 crores. My colleague Sajid caught up with Manika Khanna, chairperson and MD at Gaudium IVF and Women Health. Listen in to a slice of that chat.
Hello and welcome to IPO Central. My guest today is from Gaudium IVF and Women Health. It's a company that's into women health care. And their IPO is opening on Feb 28th, closes on 24th, price between 75 to 79 rupees per share. It's a total issue size of 165 crores, which includes a fresh issue of 90 crores. And joining me today is Dr. Manika Khanna, who is the chairperson and MD of the company. Dr. Khanna, hi. Thank you very much for joining us on ET Now. Ma'am, can you take us through your business model? I understand that you're into women healthcare facilities. Take us through the business model and how expanded is the your business is.
Okay, great. Hi. Gaudium IVF, I am glad to say, is going to be the first from the IVF industry to be listed on the main board of the capital markets. And I would like to first highlight that the need for IVF is growing and rising by the day with increasing stress in our lives, with increasing lifestyle diseases. We are the diabetic capital of the world. So diabetes affects both the male and the female partner. With all this happening, the need for IVF is rapidly increasing as 15 to 20% of this huge 150 billion population is facing infertility issues. And right now, only 2% is coming forward for treatment, and the rest is a totally untapped market. Gaudium IVF has, worked hard and formed a legacy of 16 years. We were, let's say, born in 2009 when we started a small facility, 800 square footage, but with the highest possible equipment because of my training from both Germany and Australia. And from there, the journey has been very interesting. And 2009 to 2015-16 almost was a journey of a doctor seeking excellence. And we first focused on achieving clinical excellence and achieving success rates which are now have been consistent at 58%, comparable to some of the global best. And achieving these success rates has been possible because, we attract talent, then we train them ourselves. We train our own team in-house, all the doctors, the embryologists, the nurses. So we create the skill. And also, we are completely SOP-driven. So out of the learnings of 2009 to 15, we created SOPs for every possible department, right from clinical, embryology, down to housekeeping. We laid down SOPs so that, we kind of broke down the process of IVF into like an assembly line so that it is totally standardized before we start replicating. Because my mentors in the earlier years told me, who were some leaders of Boston IVF, that, if you should replicate only when you're confident that you can deliver the same success rates across all centers without your physical presence. So these SOPs laid down the foundation for that. And that is when we decided that, okay, my entrepreneurial journey started somewhere 2017-18. And from that one center in West Delhi, which was the first center was only a couple of years. Then we had a 10,000 square feet facility center, and then we built a state-of-the-art 12,000 square feet facility, dedicated IVF space. And from there, then we started expanding to South Delhi, to Punjab. We have a hub and spoke model. So we create hubs like, for example, a city in Punjab in Ludhiana is the hub. There are spokes in the neighboring cities. Then we went to the east of the country. We opened a hub in Patna and spokes around it. We went to the north, Srinagar hub and spokes around it. Mumbai, similar fashion, and then down south in Bangalore.